now can watch this down the road. Thank you, Alex. So yes, Alex Hepner is our fantastic project manager who keeps all of the many balls in the air, and we're grateful to her and her leadership. So hi, everybody. My name is Katie Abbott. I am an associate professor of gerontology at Miami University, and also one of the co-founders of Preference-Based Living. And we'll share with you some of our website materials towards the end. But we try to do work that helps support providers and work with providers in your attempts at honoring preferences, assessing preferences, developing care conference, materials that focus on preferences. And in this recent project, we brought on a couple of speech-language pathologists because of the ever-increasing need for and struggles with communication. And so we are just tickled to be able to bring this to you today. And I would like to introduce to you our two speakers. So first off, we have Dr. Vanessa Burshnic. She is an advanced fellow in geriatrics at the Durham VA Geriatric Research, Education, and Clinical Center, and a speech-language pathologist for the VA's Caring for Older Adults and Caregivers at Home program, also known as COACH. Vanessa's research focuses on using cueing strategies and care partner training to help people with dementia maximize independence and participation in daily life. And we also are joined by Dr. Kelly Knollman-Porter. She is the Robert H. and Nancy J. Blaney Assistant Professor in the Department of Speech Pathology and a Scripps Gerontology Fellow here at Miami University, and she just got promoted, so she'll be an Associate Professor starting July 1. Congratulations, Kelly. She has over 29 years of direct clinical experience working with adults with acquired cognitive and communication challenges related to brain injury. Her research focuses on finding efficient and effective methods to facilitate functional communication. And so without further ado, I do want to give a couple of things. So please put any questions. There should be a Q&A function. You can put questions in there at any time. We want this to be as interactive as these things can be. So either you can drop something in a chat if you have a question or in the Q&A box. And so please feel free to do that. And so now, without further ado, I want to turn it over to Kelly and Vanessa. Welcome.
Thanks, Katie, and thanks, Alex, for the nice introduction. And welcome, everyone. I'm so glad that you can join us today. It's beautiful and sunny here in Oxford, Ohio, and it looks like it is also in North Carolina. So wherever you are, I hope you're having good weather like we are. But we're excited to share with you some tips based on our experiences of some evidence-based methods to facilitate engaging with residents with communication challenges. And I really feel Vanessa and I are both very passionate about this topic because, of course, we're speech-language pathologists, so we believe in the importance of communication. I do like this quote. It was put out by our national organization, the American Speech and Hearing Association, but communication is the essence of who we are. It's the essence of human life. And one thing that we're both very passionate about is giving all people the right and the strategies to facilitate communication to the greatest extent possible. We feel that for many reasons. Communication is multifaceted. Of course, especially working in a residential facility, it's very important for us to be able to understand the basic and wants and needs of our residents. It's also very important for information transfer. So if there's been a change in schedule, in order to decrease frustration or even agitation, it's important that we're able to relay that information efficiently and effectively. Even more so, I think communication is essential to develop social closeness, develop relationships that will increase quality of life. It's also important to express etiquette, but you can see there's many, many reasons why communication is essential in a meaningful life outcome. Oftentimes when we think about communication, or when we use communication, the most frequent method that we use is speech. It's almost automatic and effortless for the majority of us. But working in residential facilities, we realize that there are some people that might have difficulty not only expressing their thoughts and feelings through speech, but also understanding what we express through speech. So throughout this presentation, we are going to challenge you to think outside the box a bit and think about a variety of different ways that we can effectively communicate with our residents, not only through speech, but also by supplementing it with other means that might actually help, again, to facilitate their understanding of us. So just to start out, communication involves expression, and expression can happen in multiple means: speaking, writing, also through typing. Facial expressions, I included the image on the right just to show that, so much is relayed just by the expressions that we have on our face. The voice inflection we use, the body language. Another thing that I want to challenge you to think about is our gesture use. There are many common gestures that we use that can effectively relay how we're feeling, and it can be done effectively without use of any supplemental materials other than our hands. We can also use visual images. It could be drawings or pictures to also express ourselves or to help someone understand an intended message. Another essential part of communication is understanding. If we're just expressing one-sided and there's not a listener to receive that information, communication is lost. So we have to also think about how our listener is interpreting what we're saying. Now, communication can be, again, done in a variety of ways. Most obviously, we think about someone's ability to understand what we're speaking. However, if you think about speaking, or at least the understanding of speech, hearing, of course, is required. And a recent study revealed that amongst individuals that live in nursing facilities, only about 30 to 35% have adequate hearing to consistently understand spoken words. That's 30 to 35%. That means that there's a very large percentage of individuals who have inadequate hearing to hear us in all contexts. In addition, another way that people can understand information is through reading, so our understanding of written information. Unfortunately, many of our residents also have vision impairments. So maybe they have cataracts or glaucoma, or maybe they have glasses, but they haven't been fixed in a while. And because of that, their ability to adequately see the visual information we present might be a challenge. So it's important to think, again, when we're talking about the area of communication, we have to not only think of how we're expressing it, but how well it's being interpreted. For example, I included the image in the upper right corner of kind of an abstract piece of art. Our way of interpreting that image can be very different. So if we're wanting to relay information to someone, we want to make sure that it's very clear. In addition, communication does involve cognition. And many residents, again, in our facilities have co-occurring memory problems. So we have to realize that even though we do present information, either express it very clearly and effectively, maybe some individuals might have short-term memory problems that make it so that that information does not persist or last. So therefore, the information is lost not long after it's presented to them. So again, we have to provide methods that will help that information stay longer so that they can access it more for repeated reinforcement. Now, of course, individuals with communication challenges can have deficits in expression, understanding, or cognition in isolation. But many of our residents have multiple levels of communication challenges. So it not only impacts speech, language, cognition, it can impact their hearing, their understanding, a multitude of areas. And I'm going to talk to you about a past client I had, and I've changed his name to protect him from that. And but I want to share a client that I worked with. His name was George. And just to kind of present to you kind of a case where he did have multiple levels of difficulty with communication. So first of all, he had a hearing loss. He was a farmer and he spent many years on a tractor and was exposed to loud tractor noises, of course. And because of that, he was diagnosed with a moderate hearing loss. He was 85 years old and he did get a hearing aid. However, he didn't like wearing his hearing aid. It bothered him. He felt like it was more of a distraction than a help. So already walking into this scenario, we had the challenge of dealing with unaided hearing loss. In addition, he also had sustained a stroke about a year prior to his time being in our facility that resulted in him having impaired word finding difficulties. He had aphasia. So it took him longer to express his thoughts and ideas. Also, he had co-occurring difficulty comprehending consistently what was spoken to him. So he had difficulty comprehending probably, I'd say, 2 to 3 unit commands or instruction. In addition, he wore glasses, but he did have some difficulty seeing fine print. The reason we were brought in is because the staff was noticing that he was experiencing increased moments of agitation and frustration. And it was becoming more and more prevalent the longer he was in the facility. So we had to come up with some creative methods to help George not only express himself, but also understand what was being spoken to him. I'm going to kind of revisit George throughout the beginning part of this presentation to kind of apply some topics. But as we are thinking about George, I also wanted to share with you some information on effective communication. So what is involved? What are the key things that we have to look for when we're communicating with someone in order to make it effective? First of all, it involves both parties. Second of all, it incorporates a variety of conversational topics that are relevant to both parties. Also, we have to, again, think creatively about the method of communication we're going to use and to consider both verbal and nonverbal methods of communication. I'm going to go into a little more depth about each of those. So first, engagement during interactions. For someone like George, who has expressive aphasia, he will require more time to respond. It takes him more time to process the information that was spoken to him and more time to express back what he's feeling. That, of course, can be a challenge when you're working in a facility where you're very busy and you have high productivity demand. But it's important for us to remember still that communication is a two-way street. And effective communication and person-centered care is going to be more effective if we can provide some time not only to respond to questions, but also listen to responses. So it's very important that we give more time. And I'm going to give you some ideas on how to be a bit more efficient in that as we go on. In addition, we have to talk about a variety or engage in a variety of topics. So a recent study that a couple of colleagues and I did a couple years ago was we actually went into a nursing, actually 5 nursing facilities. And we documented the different types of interactions that we observed between residents and staff. And we found, not surprisingly, that the majority of interactions included small talk, basic greetings, or very short interactions about daily care. Usually those interactions were one-sided, so it wasn't like there was a mutual conversational exchange, back and forth exchange between the residents and the staff. The least amount of conversational topics discussed were about personal or social topics. Those are like hobbies and interests for the resident. What research shows is basically conversations about personal and social topics are by far more meaningful to our residents, and it facilitates the greatest amount of engagement between partners. So we really want to challenge you to not only think about those very important things that we talk about, like daily care, but how can we get to know the resident a little bit more to converse with them about things that are important to them. It just so happened, and I did not plan this intentionally, George was very passionate about basketball, and right now I know it's March Madness, so maybe some of you are very into following the craziness of that. I can honestly say I'm not a big basketball fan, so very quickly I had to kind of beef up on my basketball terminology in order for me to think creatively of ways to develop communication methods to help George at least communicate to staff when he wanted to watch certain basketball games. Last but not least, a very important step of effective communication is, of course, use of appropriate verbal and nonverbal communication methods. While I know verbal communication is most efficient, and as you can see, I'm using that now, it's important, especially for George, for us to find different methods, thinking outside the box again, about how to facilitate his expression and understanding. And that's what we're leaning into. So bottom line, what the research shows is if we use effective communication methods, it will increase our residents' well-being and confidence. Research also shows that it increases a positive self-image and it has a positive impact on mental health and quality of life. So this is a win-win situation for our residents. Also, it's found that it has a mutual effect to the staff. So the more staff feel engaged with the residents, they feel higher happiness about their job quality. In contrast, lack of effective communication can unfortunately lead to social isolation and frustration. And that's what we were seeing with George. He was starting to pull in. He was getting frustrated because, again, he couldn't even express his basic thoughts and needs consistently and effectively to staff. And on top of that, he couldn't understand consistently what they were saying to him. As a result, it can result in depression and anxiety and have a negative impact on mental health and quality of life. So what do we do about this? This is a big challenge, but there's many things that we can do. And first of all, I always start this and I say it's essential that you create a good environment for communication. For George, this was essential. When I walked into his room, I would have to close the door. I would have to remove all background noise. I would have to turn off the TV. It's something that we're taught early in our careers in healthcare professionals, but sometimes we get rushed and we fail to do that. But of all those things, one thing that I also find very important is getting down at a face-to-face, eye-to-eye level to engage in communication interactions with our resident. So I will intentionally, pull a chair up beside the bed if the person's sitting in the bed or in the chair to make sure that we're face to face, because that way they can see my face, they can see my facial expressions, so that if they do have hearing impairment or they have difficulty comprehending, they're picking up my nonverbal communication methods to glean more information. It also helps them understand that I'm vested in the conversation. I'm not doing something else, but right now they are my top priority. And George needed to see that. In addition, I changed my speech patterns just a little bit, almost like I'm doing during this presentation. So I over-articulate my words. I slow my speech more and make it so that they can clearly see how I'm moving my mouth. Because it has been shown that the more people can see and how we speak, the more effectively they're going to be able to understand what we're saying. Now, mask use can be a challenge. Hopefully we'll get away from that eventually. And we do have another webinar available specifically talking about different methods to communicate with masks. So I encourage you to try that out. Another thing I want you to consider are use of gestures. I have to admit, you're probably not seeing it fully. I do talk a lot with my hands. And probably some of the reason why I do that is I've found that gesture use is so effective when engaging with my clients that have communication challenges. I don't want you to be intimidated by gesture use. A lot of times when people think of gestures, they think of American Sign Language, kind of a very structured form of gestural communication. But I would encourage you to think creatively about gesture use. Try to find gestures, mutually agreed upon gestures that you can use with your client. For example, the first example at the top is a pantomime gesture. This kind of picture this as being like charades. So you use your hands to demonstrate an object or an action. You can see in the first picture, she's bringing her hand up to an ear, a common symbol for like talking on the telephone. We also have emblems like common gestures specific to a culture. So a lot of times when I'm engaging with a resident and I'm concerned about them, maybe they're frustrated, I'll say, you, and I'll point to them and I'll say, how are you? Are you cold? Are you hot? Are you hurt? So, and then I'll help you. So just very basic common gestures that we use anytime in society. There are also dialectic gestures, and these are gestures to convey directions. And I use those with my residents also, especially if in a new location. When developing gestures, again, make them personally relevant. So in George's case, I knew he liked basketball, so we had a common gesture that we used whenever I would walk in to see him, and I knew it was basketball season. I'm like, basketball, is it going good? Basketball good? And he knew that gesture for basketball, and he would use it with me a lot, and we'd have our gestural conversations about basketball. But another nice part about gestures is you don't need any materials other than your hands. Now, George did have a stroke, so he did have hemiparesis on one side. So a lot of the gestures that I create are one-handed. So for example, even though my image here shows drinking a cup, all you can do is take your hand like you're holding a cup, bring it up to your mouth, and you only need one hand to use that gesture. Gestures are also very effective if you're doing daily care. So if you're helping bathe a resident, you're not having to pull out paper or a device or something like that to facilitate your communication. You can use different gestures, dialectic gestures or emblematic gestures to help the resident understand what you're doing and to ask how they're doing. The cold and the hot is very important in those cases. For George specifically, he also liked requesting a certain different beverages. He liked drinking different beverages, of course, but he had difficulty expressing those words specifically. So we came up with a creative gestural method for him to specify which type of drink he liked. So he would start by gesturing a drinking method, common gesture that's well recognized by many people. And then he specifically liked Diet Coke. And he was a farmer, he was a dairy farmer in particularly, so he liked drinking milk. So he would gesture, drink, and then for Diet Coke, he would mimic opening a pop can with one hand. And then for milk, he would mimic milking a cow. And that way he could express to the staff if he wanted a Diet Coke or a milk. You can also use written supports. And I'll be honest, many of these supports I use in combination. So I might use speaking, gesturing, and then also have a written support option available also. The nice part about written supports is they're consistent. They stay, they don't disappear unless you take them away. They're also very adaptable. Now, the fact that they stay is very important for individuals with short-term memory problems. So let's say I know that lunch is going to be running 30 minutes late because there was a problem in the kitchen. Instead of me just relaying that information verbally to someone, I might write that down on a dry erase board that they have right at their tray table so that they can go back and look at that again for the added reinforcement. Okay. The materials needed for this are easy. I a lot of times use just plain white sheets of paper and a black marker. I like that because it provides a lot of contrast. Okay, contrast. And for those with visual problems, it's better to have greater contrast, and the black on white just stands out. I also like to carry around a dry erase board with me. Or in today's technology age, you can also use a tablet. When you're providing written support, I would challenge you to not feel like you have to write a full sentence. Just write keywords. So, are you hungry? You could see I wrote hungry down here in 2 ways. I'm a bit older, so I was taught to always write in script or cursive. However, whenever I write in script, it is not as easily interpreted by someone, especially with vision problems, as if I write in print. And I use both capital and lowercase. Research suggests that if you use both capitals and lowercase, because in the changes in size, it's easier to interpret. So write keywords, print, make it dark with contrast, and they're going to have a better chance of understanding. George was able to comprehend these single words very well. And I would use that oftentimes to try to just provide the most important information to him. Here's another example of what I would do with him often. If there was a Purdue, he was a Purdue basketball fan, And so I would write on a board and I'd say, hey, that Purdue game that you want to watch is at 7 o'clock today. And I would put that on a dry erase board. He could not only use that as a reminder, but then he could also hold that up to staff if it was getting close to time and he wanted them to turn on the TV. Last but not least, you can also use pictures to support communication. Now you can do this through pre-made communication boards, and there are two examples here. There's a letter board and there's a picture board. And for some individuals, this can be very effective in relaying basic wants and needs, but I would like to give a little warning with the use of these. I've seen these a lot of times used in facilities and they end up kind of sitting off by the bedside for not everybody, but certain people with communication challenges. And the reason why is there's so much information on them. It can often become overwhelming. And for those that have vision challenges, they might not be able to distinguish between the different squares. So I like to lean more towards a personal method of use of pictures and written support through a personalized communication board. And in order to keep them usable, it's good to use clear, visible pictures that are not ambiguous with a plain background, and then it's always good to kind of laminate them to protect them. But you can use different amounts of grid depending on the person involved. You're going to use more or less pictures, but this is just an example that I used with George. Again, because he was a basketball fan and he always liked to eat popcorn during the basketball game, I found some very basic images off of Google Images and I printed them, laminated them so he could consistently relay what he wanted to watch. Did he want to watch a UK game or a Purdue game? Did he want to eat popcorn or did he want to do something else? Okay. So basically what I would like to challenge you to do is think about communication in many ways and don't be afraid to experiment. Don't be afraid to try. It might not always work in all cases. So work with the patient, have them involved in the process of finding whatever methods are most effective for them. And I'm going to pass this on now to Vanessa to take over.
Could we ask a quick question?
Absolutely.
Okay, so a question came in from Lisa, and I'll
Yes.
just read this question for you. I'm interested to know what the regulations are about having a mask which is clear where residents can read my lips. I have speech therapy and speech assistants who are allowed to wear one, however, I am not. I'm curious as to why, since I work directly with the long-term care residents and have been pursuing this right for over a year. I literally have about half who can't read my lips any longer. I write out short questions to some who are able to read. Any ideas?
I do not, and I'm gonna reach out to Vanessa too. I have not heard anything that is specified that there are certain people that can have the clear masks and others that don't. I am wondering, and I'm just going to say this. I know probably the clear masks are more expensive, so I'm not sure how much of this is a financial limitation. But I don't know of any specific regulation. I do like the clear masks. I do think that they are very effective, especially for those individuals with the hearing impairment. It really helps a lot because so much is blocked by the mask.
Yeah, I know at the VA, we had a discussion about this early on in the pandemic, and what I know about this is that there's certain grades of masks, and so as long as your facility has likely set a grade, and maybe your infection control nurse would know more about that, but most of the clear masks meet that grade. So again, it could be down to cost, like Kelly was saying, but it should be justifiable based on the grade of the mask and what it's rated for.
Wonderful. No, that's it. So go ahead, take it away, Vanessa.
All right. So I'm going to be talking about communication supports for residents with memory challenges. But in other words, I'm talking about residents with dementia. And the important thing to know about this population is that their needs are not unlike our own. needs for connection, order, routine, purposeful activity. These are things that we all want and need. So, you know, a lot of these aids are not only helpful for people with dementia, but any resident. Go ahead and next slide. All right, so when we think about aiding the communication of people with dementia, I like to break it into 3 separate categories. So we have supporting communication with others and self, supporting communication with the environment, and supporting communication during activities. And the reason I put self in there in addition to others is because dementia causes difficulties with orienting to self and to situation, to context. And so a lot of these aids are helpful for that. So go ahead to the next slide. All right, one of the first interventions we'll go through are memory books. And memory books are among one of the most researched interventions for people with dementia and are really effective in helping meaningful engagement. And basically what they are a simple photo album with labeled photographs, just like you see here to the right. And they are tailored to the individual, and they contain meaningful facts and events. They can be topical, or they can be autobiographical to where they tell the person's life story. Next slide. So as I mentioned, memory books can be centered around specific topics. So I've encountered residents before who have limited speech, or they are not able to provide their life history. So I learn one thing about them and I create a book for them. So 2 of those examples are above, and one is for a resident who was from Norway in her early life. And the one on the right is a book about Tampa memories. I had a resident who just loved to talk about and reminisce about his life in Tampa. And things he used to do downtown and riding the trolley and things like that. So we made a book about Tampa memories. Memory books can also be helpful in addressing challenging behaviors or responsive behaviors. And one of those examples could be wondering where a lost relative is. Now, what I typically recommend for this is a page that addresses the death of that loved one and putting it in some positive, reassuring way. So you could say, you know, rest peacefully here at this cemetery, or, you know, my wife Jane, we had a happy life together, and she rests peacefully here, with a picture of the gravestone. Another example here on the right, my boys live far away, so I don't get to see them very often. I look forward to spending special occasions together. This page was made from a memory book where every evening, so him and his wife lived in a assisted living facility, and every evening when they went down to dinner, he asked if the boys were coming. And this was really hard for his wife to deal with and address every evening. So we made a page in the memory book about that specific topic. Okay, next slide. Okay, so another effective intervention for helping people with dementia, reminder cards. You know, we know repetitive questions, repetitive statements are pretty common in this population. So basically what a reminder card is it serves to solve a problem, answer a question, provide reassurance, or support memory in some other way. Dementia, you know, primarily the challenges are with attention and memory, particularly short-term memory. And as the disease worsens, auditory comprehension. So when we say something verbally, it doesn't stick around, putting it just bluntly. It can go in one ear and out the other. So what this does is helps retain that information and keep it in mind. So, and also lessens demands on other impaired systems like the auditory comprehension system. So some of these examples here are specifically one from the Durham VA over here on the right. So we have veterans come into the ER and they're disoriented and they don't remember how they got there. So we recommend reminder cards like these. I'm at the Durham VA Medical Center. I'm here to receive medical care. We have some individuals who don't know why they're taking medication. They might be resistant to taking that medication or suspicious of it. So we can provide reassurance with a card that says, I take my pills to feel better. Next slide. here are just some steps to using reminder cards. So what you're going to do is when the person asks a question, you could state the answer to the question or concern and write it on an index card. So you could write, if their question is about a doctor's appointment, you can write, my doctor's appointment is at 1 p.m. And then you read the card with the person, make sure that they can understand it, see it okay. And then when the question is repeated, instead of repeating the answer, you can say either read the card or, I think the answer to that question is on your card. That second one is nice, and it can be a little bit subtle, and it kind of conveys that we're both seeking the information, instead of a sort of authoritarian read your card. And just keep repeating that process until, the person learns. And over time, what we know is that repetition and consistency with this procedure can help the person learn to rely on the card instead of you for the answer. So next slide. And just some helpful hints for reminder cards. Use large print, like Kelly was talking about earlier. A few simple positive words. There's some people naturally learn to write in all capitals. I'm noticing that with some of the care partners I work with in the home care program. And it's actually more difficult for people with dementia to read that. So what I recommend is just a simple sentence case. You can type them or write them. Use personal pronouns, so make the message personal. My doctor's appointment is at 1 p.m. My wife will call me at noon, or I take my pills to feel better, that example. And read the message out loud, just make sure everything's clear, and of course with the person as well to make sure they can understand it. I'll just go through a couple examples here in the next 2 slides. All right, so here's one example of a person who said, I need to find my wife. The reminder card said, Frances knows I am here. She will call me at noon. Next slide. This is an example from a veteran who was in the ER and he refused to eat because he didn't have any money, and he thought he needed it to pay for the food. And so you can provide reassurance through a card that says my meals are paid for, or even if you want to get a little more creative, you can create a meal voucher that says good for unlimited free meals, and the person can feel reassured that they have this voucher with them. Next slide. Another alternative to reminder cards that can answer some memory difficulties are pseudo letters. This specific example from on the left is from a resident or a patient at Tampa General Hospital who was found lost in a McDonald's parking lot, and who was really concerned about where his vehicle was. He sort of didn't recall, what happened to it, what the police did with it, and he just knew that he was in the hospital and needed to figure it out. So he was actually admitted to a psych unit, which tends to happen for people with dementia, unfortunately, and was, banging on the nurse's window at this nurse's station, and was just really upset and concerned about his car. So what we did was we created a pseudo letter that was just a letter from the police department. And mind you, this was information that was true and accurate. We just, the individual just was more, he was suspicious and concerned, and also his memory impairment interfered with him recalling that information. So this letter was something physical to support his recall, as well as reassure him that his car was in a safe place and would be cared for. And the right is just another example from a mentor of mine about someone who was concerned about their direct deposits. Okay, next slide. All right, so now we're going to be talking about supporting communication with the environment, and these are just a variety of strategies to support wayfinding, orientation, organization. Next slide. Okay, so first step is wayfinding cues. So this is just simply signage to help residents find their way. Again, large text, picture, or recognizable symbol, such as a picture of the resident or a picture of something symbolic of the sign. So the dining room with a picture of a hot bowl of soup. High contrast. So studies have shown that residents with dementia prefer signage with colored background over white signs with white signs with black font. However, you know, when it comes to informal communication aids, we recommend using whatever you have, and, you know, just making sure the contrast is high. The advantage of using color for signage is that you can create thematic areas. So you can see green is the designated color for the dining room, and purple is the designated color for the community center. So you can help residents orient their environment by creating these thematic colors throughout the facility. Next slide. Okay, orientation cues. So these are things that we can really take for granted. Individuals, you know, with dementia, they benefit from having these type of cues and cues that are visible. So these are just a few examples. I find it most effective to use a digital clock. You know, it's large, it's clear. You can get these nice ones. This top left example is something you can find on Amazon, and can just be a really simple tool to help the person orient to the time and day. You can use notes for orientation, and provide a to-do list along with that if the person is looking for things to occupy themselves, and also reminders. You can use it for that too. Next slide. So this is something that we reviewed in our webinar on communicating with PPE as well, but name tags. So name tags are great for not only staff, but also residents. And really what we mean by that is readable name tags. And so what I do, and when I was doing home visits before the lockdown, I had my VA name tag and my dementia friendly name tag. And my dementia friendly name tag looked just like that one at the top that says Linda. And what many facilities do nowadays for residents with dementia is they'll have first name tags for the residents as well, because we can all kind of think about how embarrassing it is to forget someone's name, and you know, just the comfort of knowing someone's name and knowing the names of people around you is just really meaningful. So it can be helpful to have these with residents as well. Okay, next slide. Another type of signage for the environment are organizational cues. You know, as we get older, our vision gets worse, and especially individuals with dementia, ability to see contrast, you know, the age-related vision deficits that we can experience, they affect our ability to see and identify the objects in our environment. So simplifying things, you know, can be really easy to mix up something like a soap container and a lotion container. So if we just modify the environment, first of all, decluttering and simplifying things, but then also clearly labeling things so that they can identify them and use them properly. Next slide. So these are just additional examples of signage, and signage on the left for labeling drawers, labeling trash and recycling. These can also be accompanied by symbols and different colors to support it further in that way, and signs for instruction. Next slide. All right, so these are just some simple strategies for activities that we'll go through. Next slide. All right, so these are things I really love to use. We have many veterans who have to take their hearing aids off for using the shower. So I'm often creating visual sequencing aids for the shower, and it's basically a list that has pictures accompanied with it. So this one on the left is getting dressed, and you know, it's important to consider too that the person's typical routine. So someone, you know, might put their shirt on before they put their pants on. So you want to follow the person's typical routine and make the list according to that. And of course, you know, making sure the font is large enough and the pictures are big enough and things like that. And then the example on the right is just for a wreath making activity. So you have your materials, you have your steps, and you have visual examples. And of course, this accompanied by a model can be very effective in helping someone feel independent and feel guided in an activity. Next slide. All right, and these are some of my favorite things to recommend. As we know, with dementia, initiation can get impaired. So, you know, a person can kind of walk around aimlessly and not really know what to do or how to engage themselves. So these nice, polite, invitational signage examples can be great for that. So These come from assisted livings for people with dementia or memory care units. And the first one says, please help put the groceries in the cupboard. And so this was placed near the dining area. So it was kind of with the theme of this is the kitchen and food area. And so when people with dementia would come by and fill the cupboard, the staff would know, okay, you know, kind of look around and make sure that no one's around and then unload it so that the next resident could come by and fill the cabinet. Same thing with the middle one, please help arrange the flowers. This was in an area of the facility that was kind of garden themed and flowers and things like that. And the right one says, please fold the clothes. So it helps the person know what to do and what's expected of them in that situation. Next slide. So these are just some general tips and principles for creating memory aids and communication aids for individuals with dementia. They should be attractive to the user, desirable, perform a useful function, needed frequently or every day. So I often, as an example of that, I often recommend for my care partners to review the orientation aid at meal times and the list at meal times so that you have a regularly scheduled time where you're looking over the information and reinforcing it. Incorporate the person in the design as much as possible. Just like Kelly was talking about with the communication boards, it's really important to have their input. An example that comes to mind is I have a veteran who his wife was getting very frustrated because he kept overwatering the plants. And so we were trying to figure out a signage system that would remind him not to water the plants that he had already done it that day. So I talked to him and I said, how would you remind yourself? What should we write on this sticky notes? Because we were putting sticky notes on the potted plants. And he told me that he would write do not water. So, you know, there were options. We could write do not water. We could write this plant is watered. You could do it in a variety of ways, but using the person's own words in that aid was really effective for him and worked really well. And again, like Kelly was saying, keep trying, try different strategies, be creative. Particularly with dementia, repetition and consistency supports learning. So the more you can try and consistently implement your strategy, the more effective it's likely to be. And in general, with problem solving, think about vision challenges if the message is too complex. And if you compare it with any established routines or change the location of the sign or whatever you're trying to use to encourage use. And that's it. Next slide. So that's it. Thanks for listening. And please let us know if you have any questions.
Wonderful. Thank you so much, both of you. So we've got one comment and another question for you. I'll read the comment first and then I will read the questions. So Lisa mentioned, and it was about when you were talking about the name tags. She says, good idea. We had our marketing personnel make buttons with their smiling faces on them. As we had done this for our employees and they could still remember our smiles, the residents immediately wanted to know where their buttons were. We quickly remedied this. So that's just a fantastic story.
I love that. Yeah,
Isn't
that's
that great? Okay, so then another question I'll read, but if you have other questions, please put them in either the Q&A box or the chat box so that we can answer your question. So the next question, for those caring for individuals from diverse cultural backgrounds or who may have English as a second language, are there things to keep in mind around specific nonverbal communication techniques and gestures? Maybe Kelly, if you take that first, and then Vanessa.
Yeah, I decided to go ahead and stop sharing just so we could see our faces a little bit more. I hope that helps. Yeah, absolutely. You can use any of these methods. Again, gesturing is a very effective method, and again, picture support. So pictures are universal. But be mindful of when you're selecting the pictures. I'll be honest, Vanessa and I are working right now on a study where we're trying to find visual images to support the Peli. And so we're very mindful of the images that we're using so that it represents a variety of cultural backgrounds and also making those images representative for the person. But, you know, don't be afraid to reach out to the family too, to get images of the family members, get images of their home, maybe pets, images of things that are very personally relevant to them. So I've used images a lot of times with English as a second language learners who may be following aphasia, rely more on their first language than they do English. So being able to use images and gestures to go along with that, I think is a great way to go. Vanessa, I don't know if you have any additional thoughts on that.
I don't. I have nothing to add. I think that sums it up.
Okay.
Alex, any questions that you're seeing that I'm not seeing?
I'm not seeing any more. Oh, did you see one?
I see one, yep. Any thoughts on how to help residents transition into a facility when they are angry with children for bringing them to a facility? Oh, that's a great question.
Yeah, and it's so common too. I've actually had residents where the family lies to them and tells them something else, and then they're kind of thinking that that's the story. My go-to would be a memory book, kind of explaining how they got there, especially if it's a resident with dementia, how they got there. You know, it's a way to positively engage with the person. And the page I would end with in that memory book would be, we'll just make Sunnyside Nursing Home. I moved to Sunnyside Nursing Home to receive assistance with my care. Something where it's just kind of blanket, positive, even toned. You know, you could say, my family knows I'm here and visits me often, something like that, just to kind of answer any questions and smooth that over. But perhaps that helps it could be a way to help them transition and understand the process of how they got to where they are today. That would be my first thought.
And then also, I think that's great, Vanessa. I would also really try to figure out more about what, again, is that individual's personal interests. Not to totally distract, but the sooner that you can find out what they like to do and find a way of adapting that in your particular environment will be very helpful. Maybe they had a garden at home. So how can you get them to help plant a plant that they can have in their room that they can take care of? So again, even when I'm feeling bad, you know, if something's not going right, that, you know, or isn't going the way I'd like to, especially during this whole pandemic thing, finding ways for us to find activities that are going to make us feel better might help distract from that a bit.
And, you know, I know this is something the Peli team has been working on, but, you know, validating the person's emotions and just starting off by acknowledging that and saying, oh, that must be so frustrating. I'm so sorry. While we wait for more answers from your family, would you like to do this? So kind of start with acknowledging that frustration, because it's likely not going to go anywhere for a while, or at least it will be subdued by them knowing that you get it and you've heard them out, and then try to transition to something they might like.
I love that, because that's so true. Their feelings are legitimate. They were put into a situation that they weren't aware of. So validation is so important.
Those are great points. How about, why don't we bring up the slides? I know that we're almost out of time, and
Sure.
I want to just do our little commercial for, you know, we'd love to work with providers, and we love to hear your pain points and try and figure out solutions. And so, did we have a slide about our website and our social media?
I don't think we do. Ooh. No.
Maybe we can put them in the chat. So you can leave this one up. And so maybe what we'll do in the chat box, Alex, if you could drop links into the chat box. So we post regularly on Facebook and Twitter. We would love for you to follow us. And so hopefully Alex can drop those links into the chat. We also have a newsletter, and we only send one email a month, and we do not share your information. Please sign up for our newsletter if you're not already on our newsletter. And we also have a website full of information. Again, like the webinar that Kelly and Vanessa mentioned on how to communicate while wearing a mask is listed. We record these, we list them on our website. And so all of our resources are on our website at preferencebasedliving.com. And again, we also love to hear from you. And so we have a helpline that goes directly to Alex's desk. And so we would, any other questions that you have, we're happy to, bring them in, send them out to our team and get some questions about things, get some answers for you and respond back to you. And so please use us as a resource. We want to be part of the solution. We don't think that person-centered care should only be your responsibility. And so again, we're grateful for the work you do, and we want to be we want to have your back. And so I'm trying to see if there's any other questions. I don't see any other questions. Any final, and I see that Alex is dropping links into the chat. So please use our, check out our website, sign up for our newsletter, and follow us on social media. And we thank you so much for joining us, and we'll stick around for a minute or two to answer any other questions. And then Alex, do you want to explain oh, you just did it.
Yeah, so again, for those of you who maybe joined late, if you're interested in getting CEU, a certificate of attendance to submit for CEUs, you can either get your phone out, open up the camera app and scan the QR code, and you'll be taken directly to that evaluation that you'll need to complete to get that certificate of attendance. Or I also dropped it in the chat if that doesn't work out for you as well. And in case you missed it, check out the chat box. We shared the link to our website, which Katie mentioned. We'll have the recording available on our website and our YouTube channel there. And if you sign up for our newsletter, you'll also get a reminder in your inbox. We'll be sharing that in our next month's newsletter. We'll be sharing the recording as well. And then the last link is for that to complete the evaluation for the CEUs. Yeah, check the chat box if you can't see those. Those links are there.
Wonderful. So I hope you guys have a wonderful rest of your day. Thank you all for joining us. And again, hang in there. We know that it's hard, but we know we'll get through this together. Thanks, everybody.